For more, I want to bring in Dr. Uché Blackstock. She's a medical contributor for Yahoo News. Dr. Blackstock, welcome. Thank you for being with us. So many people in the U.S. are not allowing the pandemic to stop them from traveling for Thanksgiving. What concerns you most about this? Do you think it is inevitable that we will see a post-holiday bump in COVID cases?
Thank you so much for having me. I think that what we've seen so far in terms of people who have already traveled to other destinations. I know I'm here in New York City. I'm an urgent care physician, and people have been lining up to get testing before they meet with their family for Thanksgiving. I think without a doubt, we're going to see another exponential acceleration in cases after this Thanksgiving holiday. So I think right now what we need to really communicate to the public are strategies in order to mitigate that spread when they're meeting with their families and loved ones.
And the CDC is asking contact tracers to prioritize some cases over others during this overwhelming surge. How necessary will contact tracing be, especially as people travel and college students return home?
Right. So the point of contact tracing is to stop disease transmission. And so what's happening is that our public health and healthcare systems are just being incredibly overwhelmed. And when that happens, people are waiting 1 to 2 weeks to be contacted and isolated. And so right now, we really need to focus our resources on those people who have been either had symptoms for 6 days or 6 days out from testing positive. And that's how contact tracers can be most effective at this difficult time.
And so, of course, everyone is excited about this good news on the horizon, not one, not two, but three potentially successful vaccines. But these mostly pertain to adults. A Moderna executive said a vaccine for children could be ready by the middle of 2021. How different will the vaccine be for kids, and how important is it for children to get vaccinated as well?
Right. So we see typically vaccine trials will focus on adults because children are considered understandably vulnerable populations. You want to make sure that there are no safety and efficacy challenges with giving the vaccine to children. And up to this point, I believe Pfizer is the only trial that has started to enroll any subjects under the age of 18 years old. But it will be critical to vaccinating children, especially we know that children will eventually go back to school and be in congregate settings. And though they have decreased risk of being infected and transmitting, especially young children, that risk still remains. And so I can see that there will be a point where returning to school will probably require a coronavirus vaccine, just as flu vaccines are often required by school systems as well.
And doctor, how are hospitals preparing for the surge that they're seeing currently, but also the likely surge in patients after Thanksgiving? So many hospitals say they are already at capacity.
Yeah, no, and I think, this is the challenge. The reason we try to communicate to people, one of the reasons why we want you to stay home is so that you don't get sick and that you don't infect others, because what we're seeing now are hospitals in the Midwest, especially in Mountain West, at capacity. And when we have hospitals at capacity, it compromises the care of not just coronavirus patients, but patients who come in for other reasons like heart attacks and strokes. And so what we see are staffing issues. And we see that hospitals are reaching out to other states for staff workers, and they also are running into bed situations. They're even using garages and stadiums as temporary patient floors, and so they have to be very creative. But the problem is that after Thanksgiving, we're going to see another surge undoubtedly, and we have to wonder whether our hospitals will be able to treat those patients effectively.
All very scary news as we head into the Thanksgiving holiday. But Dr. Uché Blackstock, thank you so much for joining us. We appreciate it.
Thank you for having me.